Here with the Vice Chair of our Conference Committee, Assemblywoman Weber, and members Bloom and Melendez, and of course on the Senate side, Senator Lara, and the Vice Chair of our Senate Budget Committee, Senator Nielsen. If you could please call the roll.
Senators Leno.
Here.
Lara.
Here.
Nielsen. Here. Assemblymember Weber.
Here.
Assemblymember Bloom.
Here.
Melendez. Here. We have a quorum.
Thank you. So just a little bit of housekeeping. We're going to meet this morning until about noon. We'll break. All of us will be going to our respective floors for a couple hours of work. Then we'll reconvene at 2 o'clock for another 2-hour session, go till 4. We'll be focusing first on health, then human services, and continuing the rest of the week with K through 12 and higher education, resources and transportation. Then lastly to public safety, judicial and labor and state administration, general government. So that will be the order. Tomorrow's start time yet to be determined, somewhere close to around 1 o'clock. So of course the purpose of our conference committee, as it is each year, is to reconcile the differences between the two houses' budgets. And I think I can say with some certainty that the differences are far outweighed by our similarities. And what we do have in common most significantly is both the Assembly and the Senate's interest in beginning to take action to show our commitment not only to paying down debt and putting money aside for rainy day, but also to begin to reinvest in the human capital and infrastructure of the state of California. We take slightly different paths, but we get to the same end. And of course, working with the governor and the Department of Finance, we're all very pleased to be able to claim that we have been very successful to date in paying down debt, in filling our now constitutionally required Prop 2 rainy day fund, and that the state is on very solid fiscal ground with our credit rating improving on a regular basis, our unemployment rate going from about 7.5 down to 6.3 in just the 12 months. There's a lot to celebrate, but a lot of reinvesting from the Assembly and Senate's point of view. And Dr. Weber, if you'd like to say a word, you're certainly welcome to.
Yes, I want to thank the chair and all of our staff that worked so very hard, and all the subcommittees who've spent countless numbers of hours working on crafting this particular budget. Yes, our budget too does reflect both of the houses, our desire to rebuild California into a stronger California, being fiscally responsible at the same time, but investing in human capital that we know will pay dividends over and over. In addition to those who are here, I want to thank the fact that one of our alternates is here, Jimmy Gomez, who's Chair of Appropriations on the Assembly side, is here for the meeting. I don't see Mr. Obernolte in the audience, but he's our other alternate from the Assembly. I want to thank them for their time and basically attending the meetings and assisting with that. We are excited about it on the Assembly side because this does continue our efforts from last year to continue to invest in those issues that we think are critical, that will make California stronger and more resilient. We're excited about the impact of the Rainy Day Fund in terms of what it's going to look like and its growth in terms of being able to at least provide some buffer in more difficult times and difficult years. So we look forward to this process. We're excited about the packages that we see. We wish we had enough money to fund everything in it. We know that's not possible, so this is going to deal with issues of priority and appropriateness and what has the greatest impact on California. So thank you, my chair here. I'm looking forward to working with Mr. Leno as we go through this process.
Thank you. Madam Vice Chair, Senator Nielsen.
Thank you, Mr. Chairman. It's an honor and a pleasure to serve with all of you. And again, as Assemblymember Weber has noted, with thanks to all of our staff. They labor even harder than we do in the dark of night, and we thank them for their valiant efforts. And our members who've labored long and hard in the subcommittees that got us to this point. It's well that we have a better budget picture this year. That's an encouraging thing. We, though, must keep in mind the follies of the past, where when revenues increased, this honorable body got a little bit too generous, and we paid the price. And further looming out there is the great Proposition 30 sunset. The May revision figures show that California's economy can sustain our budget without that massive tax increase being extended, and that is something I do keep in mind as we proceed. As Senator Leno accurately reflects, there are many things that we've already agreed on, and we agree on getting California back on a growing path. That growing path must be also a prudent path where we keep in mind not doing things that expand the base and keeping things in tow as far as new significant expenditures. I believe that we can find that common ground, and maybe this year it'll be a little bit easier. It is a pleasure to serve with you. Look forward to our deliberations.
Thank you, Senator Nielsen. Always a pleasure to serve with you as well. Assemblywoman Melendez.
Thank you, Mr. Chairman. The nice thing about going towards the end when you speak is that most of the people who speak before you have said all the really good things, so it doesn't need to be repeated. I am very pleased and honored to be here and a member of this conference committee. I think we do have much to be thankful for in this budget compared to previous years. I think we still obviously have some work to do, and we may have a few disagreements about what areas need the most work, but I'm certain that we will come to a healthy conclusion, and would just ask that we all are mindful of the follies that Senator Nielsen mentioned. You know, California, we're kind of feast or famine with the budget, with what we rely on our revenue. And so I will happily join my colleagues in exercising some restraint when we're talking about some of these issues. Thank you.
Thank you, Assemblywoman. As we begin, let me also thank the tireless efforts on behalf of all of the subcommittees and especially their chairs through January, February, March, April, May, long Thursday afternoons, which have provided the fruit for us to be able to refine some outstanding issues so that we can get the budget passed by June 15th. And I guarantee it, we will have, yet again, another balanced budget by June 15th. And we'll have this week to reconcile the differences. Governor and leaders will be meeting throughout this time as well, because we've got to get this into print by early next week if we're going to vote on it by the end of next week. So that is our timeline. Also to keep in mind as we begin this full-hearted debate is we're probably in disagreement over about 1% to 2% of the entire general fund budget. So we're in agreement 98, 99%, but there'll be a lot of room for some full-hearted conversation and determination along the way. With that, Ms. Bosler, we welcome you back to the conference committee.
Thank you. Good morning, Senator Leno and members of the committee. It's Keely Bosler with the Department of Finance, and it's my pleasure to be here this morning to help work through this conference agenda. I too agree there's much common ground between the three budgets. We do have some differences related to the level of revenues and what the state can sustain over the next several years, as the budget does face many challenges, not only with the timing off of the expiration of Proposition 30 revenues, as Senator Nielsen mentioned, but also some growing costs in programs that are commitments that we've already made, including the implementation of the optional expansion in the Affordable Care Act.
So we'll begin on page 1. And before we start with the Office of Systems Integration, Elio, if you want to just give us a brief overview of Health and Human Services, please.
Thank you. Good morning, Chair Leno and Chair Weber and members. Mark Newton with the Legislative Analyst Office. We've been asked by the committee to provide just a brief overview before the committee begins delving into Health and Human Services budget issues in conference on the major general fund augmentations proposed by one or both of the houses in the Health and Human Services policy area. We have prepared a one-page handout for this overview. I'll just ask the Sergeant to hand this out. And just a note for the members, when you see this handout, it is not an exhaustive list of augmentations proposed by one or both houses. The major ones, essentially our cost threshold was around 10 million or so, but it's a pretty extensive list. Members, as our office has previously stated, by accepting the LAO's revenue and expenditure estimates, there is certainly some room for the legislature to make targeted discretionary augmentations for its highest priorities after meeting Prop 98 and Proposition 2 obligations. Excuse me. Because the state's robust revenue situation can quickly be reversed, we certainly advise caution, especially in adopting new ongoing spending commitments or tax reductions. So turning to the handout, and just a few things to highlight from the handout for the members. First, the handout illustrates that while there are several differences between the two houses in terms of priorities for spending augmentations, there are also certainly a handful of overlapping priorities as well. Specifically, both houses approved the same amount of general fund funding to repeal the maximum family grant policy in CalWorks. Also, to restore a select group of optional Medi-Cal benefits for Medi-Cal beneficiaries, and also to increase funding for an immigration assistance program. There also, though, are differences. We note that, though, while the two houses did take action in the area of Medi-Cal provider rates and also related to developmental services, regional center purchases of services and operations. The total augmentation levels are different between the two committees and the two houses, and different to sort of targeting of those augmentations. We also note that it was a funding priority of both houses to, along with the governor, to provide funding to restore IHSS service hours that had been subject to a 7% reduction. The difference between the two houses is one of funding source. So turning more to the differences between the two houses, you will note that from the handout that CalWorks and child welfare services spending are, relatively speaking, a higher priority in the Assembly, while Medi-Cal related increases in terms of benefit restoration and expansion of the population served is a relatively higher priority in the Senate. So finally, we note, members, that while the LEO generally does not have recommendations on the individual augmentation proposals when one house has proposed an augmentation and the other house hasn't, as that certainly comes down to a matter of legislative priorities, we are very much prepared to provide context and background to the committee to assist you in your deliberations. For example, in the case of the Assembly's proposal for a CalWorks COLA, we can provide you with information such as the impact of the COLA on grant levels, how the grant levels would change as a percentage of the federal poverty level, and what the annualized cost of such a proposal would be. So we very much look forward as an office to assisting the committee as best we can in your deliberations. Thank you, Mr. Chair. Members.
Thank you, Mr. Newton. I'm going to take you up on your offer right off the bat. On page 1, with both the Senate and Governor taking no action, difference between the houses is some trailer bill language that the Assembly took up, and wondered if you could help us better understand it.
Yes, and I'll turn to my colleague, Lourdes Morales, to
Thank you.
address
Ms.
that
Morales.
Good morning, Mr. Chair and members. I'm Lourdes Morales with the Legislative Analyst's Office. We do recommend that the legislature modify the Assembly action to postpone the due date of the requested report from April 2016 to January 2017. We do agree that it is important to assess the interface between CalHERS and SAWS and identify opportunities for improvement. However, we do note that OSI, in a collaboration with key stakeholders, is in the midst of developing significant modifications to the system that would expose the MAGI rule engine to the counties. We believe that it is important to allow these modifications to be complete, and this their overall impact in the system operation should be a component of an analysis regarding exposing the rule engines and really moving them to the county should that be a next step. Given when these changes are expected to be complete, we would recommend moving the report to January 2016 to allow for this assessment and a report back to the legislature at that time. Thank you.
So clearly, you think the work won't be done by April 1st?
Right, the expected changes that are in the midst are expected for April 2016. So the delay would allow for those system changes to be input as well as an assessment about their operation.
Is there any unintended or, well, keep it at unintended consequences if we were to take your suggestion?
To the extent that the findings of the report ultimately lead us towards moving the changes of the rule engine to the SAW, there may potentially be a delay in that work. But we do think that the overall assessment would be improved by having these system changes be completed first.
Thank you. Ms. Bossler, you have a response?
Yes, so we're not supportive of the language at this time, and I think the impact of the language, and I'm going to step back just a few steps first. We've been working in very close collaboration with the state and the counties as we implement CalHERS. I'm not going to deny that it has been difficult. There's a lot of workarounds right now that the counties are having to put in place because CalHERS is not working seamlessly with the SAWS systems. But there has been a lot of coordination to sit down and really agree upon a 24-month roadmap to make changes to the system, to improve the functionality, and really get to full implementation of the CalHERS system. I think what happens when we take a study like this, well intended, this has certainly been an issue that's been discussed at that 24-month work table a lot about where should the MAGI rules be. Should they just be in the CalHERS system, or should they be programmed in both the CalHERS and SAWS? Right now, the technical solution is to expose the rules and allow the SAWS system to interface directly with the MAGI rules in the CalHERS system. If we do take staff offline to do this study, that basically means that other things are not getting done to implement the 24-month roadmap. So our concern is really taking the focus away from what is a multi-party agreement with the state and the counties about what the priorities should be as we move forward and implement the changes to the CalHERS system. So we're not supportive of any language at this time.
Well, obviously, we believe very strongly that this is a significant piece, and I presume LAO does as well, in terms of providing the kind of services and resources that are necessary to actually implement the program that we have in place. We've had a lot of problems, a lot of glitches. Folks have not gotten services in a long time for being identified. And I assume this costs us nothing or very little in terms of the budget. Is there a financial piece attached to this?
I believe it's just the trailer bill language.
Yeah, it's just trailer bill language. So to that extent, it gets us further along to where we want to go than where we are right now.
Yeah, I think the point I was making is that there is an opportunity cost. If people are working on this report, they are not working on other changes to the system, and so there would be a delay in other functionality that we have already agreed with the counties is a high priority and should be put in place. And we are very supportive of additional resources in the budget year. We've provided $150 million additional resources in the current year and are supportive of nearly $245 million in additional resources in the county year, in the budget year for the counties to support all of the workarounds that they're having to do to run the medical eligibility for the state.
Well, we'll hold this item open, obviously.
Yes, I don't think we're going to resolve that today.
Not going to resolve it today?
Right.
Okay, good.
Page 2 is investment in mental health wellness grants. Again, the governor had no proposal. Neither did the Assembly. LAO, if you want to walk us through the Senate trailer bill language.
Amber DG with the Legislative Analyst's Office. The Senate adopted trailer bill
Could you just
language.
get a little closer to your mic, please?
Sure. The Senate adopted trailer bill language to allow the California Health Facilities Financing Authority to use up to $3 million in unencumbered mental health wellness grant funds for peer respite programs. This $3 million is a subset of a remaining roughly $50 million that the Health Facilities Financing Authority is using to increase the capacity for residential treatment beds and crisis stabilization units in the state.
So the mental health wellness grants, which would be the source of the $3 million, comes from Senator Steinberg's SB 82. And is the question for us to consider here whether peer respite complies with SB 82?
I believe that the trailer bill language allows the Health Facilities Financing Authority the flexibility to use this $3 million in funding for peer respite programs if they find that the programs meet the intent of the act.
So that would be necessary, and again, as you just mentioned, it's just permissive language.
Yes.
Could you tell us the impact this might have on other counties that are currently not providing the services, or those who are providing the services? What impact would this have on those that are already involved?
Our understanding is that the Health Facilities Financing Authority undertakes a competitive grant process in allocating these funds. Currently, that's a regional process. As of January 1st, 2016, it would become a statewide process. So I believe that they would use these funds in a competitive process in the same way for those counties when allocating the funds.
So that larger counties would not lose or would benefit from this? The counties that have already been involved in this type of activity or recipients of some of the funds for this, they would not lose funds? Is that what you're saying, or would they?
They would not lose funds that have already been allocated. This is coming from $50 million in funds remaining that have not yet been allocated.
But would they be eligible for those dollars as well?
I believe that all counties would be eligible for the dollars, but I would have to touch base with staff and follow up with you to confirm that.
I think there's a concern among some of the larger counties that they would not benefit from this at all, that their efforts in the past, they would not, in other words, almost being penalized for being good actors in the past in terms of utilization of resources, and then finding themselves not eligible now, rewarding those counties who haven't done anything in the past. So we'd like to know that in terms of impact on all of the counties. What impact would this have?
We did not see anything in the trailblazer language that was restricting which counties could apply for these funds, but we'll follow up with the Senate Budget Committee staff and follow up with you on that item.
Sounds good. All right, thank you.
Assemblywoman, worthy concerns, but given that it is a competitive grant process, and I don't believe that any of us have heard any concerns from the counties, I think they're okay with this.
Our staff has heard some, so we want to just make sure before we move forward that it doesn't have any unintended consequences of penalizing those who've done some things in the past and finding themselves, once again, not able to take advantage of additional resources.
We'll get some clarity on that.
That'd be good.
You look eager to speak?
Teresa Keller at Department of Finance. We would just note that the Financing Authority had been working with the County Behavioral Health Directors Association on this language, and it would, again, permit but not require the Financing Authority to do these grants. We have understood it to be something that smaller counties in particular have looked at for something related to crisis stabilization, but we don't know of any exclusion for larger counties or anything that would preclude larger counties from participating as well.
Would you like some greater clarity?
I think we should try to see what our counties are saying, yes.
Okay.
Okay?
If you
Good.
can bring that back to us, we'd
be
appreciate
great.
it. We'll leave that
Right.
open for now. And page 3 has to do with adult dental benefits. Again, Senate is the proposer here, and LAO, if you want to.
My stat.
Okay.
Thank you, Mr. Chair. Felix Su with the LEO. As the agenda notes, the Senate restored full adult dental benefits effective October 1st of 2015, so it's a partial year augmentation. The benefits restored under the action include partial dentures, root canals, lab processed crowns, periodontics or gum treatment, and implants.
Thank you. So again, of all the many cuts that have been made in recent years, Senate subcommittee felt that this was a top priority given the impacts on nutrition and infections and all the resulting problems with lack of access to adult dental benefits. Was it the LAO that suggested that this probably could not be implemented by October 1st? It would probably be closer to December or January?
I don't believe so, Mr. Chair.
Okay. All right. And do you have any opinion on that?
Not this time, no.
All right. If it were to be delayed, of course, there'd only be fewer costs because we'd be doing less of a year than what would be proposed here?
Yes, Mr. Chair. I believe the full year cost is estimated to be in the range of 88 million, general fund.
Yeah, very good. Any thoughts?
I don't want to be the only one up here thinking, but nonetheless, I guess everybody has thoughts. Let me just simply say, on the assembly side, this was one of the many items we looked at, and we think it's a very worthy issue. Question becomes an issue of financing, and so I think as we get down the line, we'll start looking at priorities, and so it's not something that we're opposed to.
Of course not.
But when we start adding and subtracting in terms of what's available, what resources are there, it's an item that we surely would love to consider and include. So as we get further along the process, I think we'll look much more favorably upon it once we see where the dollars are and where we can compromise and things we can shave off. So it's a good. I mean, none of us are opposed to it. It's a question of resources. Yeah.
Thank you, and I know I'll have the same comments when we get to some of the things
Right,
with the assembly
yeah,
fund.
we will, we will.
We
We'll
did.
all, yes, yes. So I think, we didn't have a proposal on it, not because it wasn't worthy.
Right. Senator Nielsen.
Mr. Chairman, just to kind of assert a collective opinion in the Senate side at least, that this is determined a priority that we feel comfortable in investing early on. Biggest complaint I've heard in the hinterlands is from, in fact, providers who just can't keep up anymore, who are considering giving up their practices or moving. And certainly, I think the preventive approach, particularly to dental care, has enormous health consequences, not only related to dental issues, but many other secondary and tertiary issues that are of great significance. So we've determined that this is a high priority, and we're not reluctant to put it up front. Of course, we'll work as we proceed, and the Assembly is well taken to try to take it all into account, but I just want to reiterate where we're coming from the Senate side.
Thank you, Senator. So, again,
Yeah, we'll put a hold on it. But, and as I said, it's not that it's not a high priority. I've already heard from a lot of the dental providers, Western Dental in particular, that's not doing any more expansion in areas where we need it in terms of communities and, those kinds of things. So it's a great concern. I mean, it's not anything that's minor on our side of the house. But it was just one of the many things as you try to balance the priorities, and we'll see where we fall in the end. But surely it is important, yeah.
all right, to be left open for now. Page 4 deals with Medi-Cal coverage and immigration status. Again, it's the Senate that took action.
Thank you, Amber DG, Legislative Analyst Office. The Senate has a proposal to extend eligibility for full-scope Medi-Cal benefits to individuals who are otherwise eligible for those benefits but for their immigration status.
I would just note on several of these items here, including the last one, there are really three. The Medi-Cal is a three-legged stool. There are rates, there is benefits, and then there is the covered lives. And during the recession, there were a lot of very difficult choices that had to be made to reduce costs in those programs. One of them was eliminating optional benefits such as dental. Luckily, 2 years ago, we were able to restore partially that optional benefit that's not required by the federal government to be provided, but it is an optional benefit that, as Senator Nielsen said, that there are prevention aspects to other health issues. This next item here, Medi-Cal coverage regardless of immigration status, our budget does assume the coverage of individuals who will move into the persons residing under the color of law status as DACA and DAPA are implemented at the federal level. That is obviously right now still under challenge in federal court, but the governor's budget does include monies to assume that at some during the year that some actions will be taken and more individuals will move into those statuses. When they do, they are eligible for full scope Medi-Cal. They're also eligible for the IHSS program and the cash assistance program for immigrants. So our concern about doing anything in the above the May revision in that three-legged stool is that those are committing the state to significant ongoing costs that right now, with the expiration of Proposition 30, the state does not have enough revenues to support. So our concern is that when the recession comes, that we will go right back into that boom and bust and have to remove the optional benefits and reduce services, which is not something to balance the budget, not something that the governor wants to do.
Thank you, Ms. Bosler. So since the subcommittee took action to set some funds aside, the Senate has narrowed our focus as to how those funds would be used, and it would be to provide Medi-Cal coverage just to children who would otherwise be eligible independent of their immigration status. And I know Senator Lara has been working on this, if you'd like to say a few words.
Thank you, Mr. Chair. You know, I do understand the DACA and DAPA issue, but that's what we have to do if the executive order stands in court. So that's part of our responsibilities, given the executive action. The additional $40 million is an investment for the health of our children that do not qualify for these. They're not going to qualify for these programs. No child in California should be left without access to health care, especially if it's already costing us $1.1 billion annually in very limited care when it comes to our emergency room. So this is a very modest approach at trying to alleviate the bigger issue of what we do with the remaining uninsured in our undocumented community. And so the Senate believes, the Senate Democrats believe that this $40 million would be sufficient to cover children for the 2015-2016 budget year. Since the initial take-up of the enrollment will be slow, and we know that children tend to be healthier and will need less care. In subsequent years, many of these kids that are under 19 will be eligible for DACA status under the president's expansion, and so will be eligible for the coverage under PRUCOL, which we discussed earlier. This budget item, I think, reflects the changes I have made to SB4 in our attempts to narrow the scope and cut down the cost. But I think SB4 should be able to cover this critical group of children. And I know it's difficult sometimes for the administration, whether it's childcare, whether it's preschool or providing health care to children. It's a difficult issue. I don't know why, but this has to be a priority for us as we move forward, especially our most vulnerable Californians, which are these children that are living in deep poverty. The additional $1 million to DHCS is therefore critical, again, to set up the program for a capped enrollment program depending on our budget. So we're being mindful of the boom and bust, but that we're also saying that we are not going to leave men and women behind that are critical and invest over $2 billion in our state budget and don't get anything in return. Again, the only option these folks have now is the emergency room care, which is triple the cost and is very limited in scope in terms of what we're doing. It makes better sense and it makes more financial sense to give these individuals an opportunity to have comprehensive care, to be able to see a doctor, which is less costly than seeing them in our emergency rooms, which is what is currently happening now. So I think this is a very important issue, and we should continue to push back on the administration on this item.
Thank you, Senator Lara. Ms. DG, can you confirm, I think we've estimated around 200,000 children would fit this description?
Yes, our estimates, a very rough estimate of when the program would be fully phased in, take-up would be somewhere around 195 to 240,000 children who would ultimately enroll in full-scope benefits.
Thank you.
And, Mr. Chair, can I ask one more
Senator
question?
Lara and then Senator Nielsen.
To the LAO, and does the $40 million seem appropriate to cover this amount of children?
In terms of when the program was fully phased in, full-year costs, we're roughly estimating to cover children, it would cost between $20 million and $150 million general fund annually. So given that it would take time to phase up to the full number of children enrolled, we find that $40 million general fund is a reasonable amount to allocate to this program in 2015-16.
Thank you.
Thank you. Ms. Bosler.
Yeah, I would just note that we haven't done a fiscal estimate on the new amendments to SB4 which I think is what we're really talking about here. But we did estimate that the prior version of the bill would cost annually about $1 billion. I'll also note that the way that we currently provide health services to undocumented, as Senator Laura said, 700,000 undocumented immigrants are currently in what's called Medi-Cal restricted scope, and so that is emergency services. But there's also $1 billion in 1991 realignment funding that funds a network of county indigent healthcare clinics as well. And so there is significant money right now invested in providing undocumented immigrants some level of health care, be it different from county to county, how that's provided. And so taking that on at the state and putting them into full scope Medi-Cal, which would not, besides the emergency scope, there would be no participation by the federal government, which is the case with the PRU-CALs as well, as they discussed earlier. The federal government does not participate in those matches. So it does become a significant ongoing expenditure for the general fund, and it's really just a matter of our current revenues not being sufficient over the long term without other choices being made to support additional coverage at this time.
Thank you. I think it was the wisdom of our fiscally conservative chair of the Appropriations Committee that led the Senate to narrow the focus of the proposal here.